Well, welcome once again to Ask Me Anything on Diabetes. Well, once again, we are here, and I'm your host, Dr. Aniket Banvi. Well, we have been receiving and we are taking meticulously the one questions which are most importantly or many a times asked repeatedly or been asked by many people. And these questions have been leading to answer many of diabetics who are suffering and give them an understanding of what they are going through in each and everyone's lifestyle. Every person is living a life in a very different manner, and he or she sees the life in a very different lens. And when a person is suffering from diabetes, the only pain that they are going through is known by them, and that is what I address and try to understand and bring in understanding of what is that they are going through and answer their pains and suffering, and how can we help them walk out of it or help you in managing it at least. And that is what I'm here to do, and where we make sure to help you in knocking your diabetes out of your life. And among these many questions that we have been receiving, one question which has been asked extensively for many a times by many of you people is about frequent urination. And the question goes like this: over the last several days, I have been experiencing frequent urination and increased thirst. What should I need to do to prevent this? It's a very widely asked question by many of my patients when they consult me. And before even talking about how to prevent that frequent urination, where every diabetics or most of the diabetics go through, it is not a compulsion that if you're a diabetic and you should have that symptom or that frequent urination factor. Some do have, some don't have. If you are going through, then here is the answer to it. Let us understand why is that frequent urination happening again and again. Now, when your blood glucose level crosses a threshold level of 180 mg per dl, your body sends a signal saying that there is an excess amount of glucose circulating in your body. Now, this indicates that the glucose which is excess should be thrown out of the body. Now, how do you do that? The body itself automatically does that by signaling the thirst center and make sure that your mouth and throat are dry. And when they get dry, you feel the urge of drinking enough amount of water. Now you end up drinking enough amount of water. Most of the times, if you see, diabetics grab or drink water sometimes eagerly, because they are feeling that urge. They are feeling that the amount of water they need, because otherwise they will feel very agitated, very irritated, and they drink even half a liter or 1 liter just like that. That is because the body wants to immediately throw that excess amount of glucose as much as early possible it can. And when you drink that enough amount of water, the glucose molecule binds with the water molecule and is sent to the kidney for reabsorption and also elimination of that excess amount of glucose. Now, when you are going, what this process happens, is it good or bad, is something that I'm asked also. Yes, the process is good only when it is able to manage it. But if it is happening again and again, it is happening for a longer duration, then definitely your kidneys are being damaged, your body is being damaged. And not just that, when you're losing that glucose, which I'm saying, it holds good amount of nutrients which is required for your body to function normally. That glucose is a raw material for your body to function normally. Now, when that itself goes out, what is going out through that is also vitamins and minerals and many essential elements that are required for your body to function normally. And as and how you see that the frequent urination, people lose these things. And that is when we see most of the time the micro deficiencies start occurring. We have seen micro deficiency of magnesium, zinc, chromium. We have seen vitamin B12, D3, and many other such vitamins. So there are deficiency, and it is not just because of frequent urination. There are multiple reasons as well, and this is also one among that, because you are losing the glucose which holds these minerals and vitamins not every vitamins and minerals which I mentioned, but some of them, and some of them not. Some of them come through different means, and some of them comes to through the glucose or the food that you consume. So this is something that you should make a note. If you are having a frequent urination, then it is a very concerning part. Now the next part, I just now addressed you, but why is it happening to you, when it is going to happen, and how is it going to happen, all of these things. Now let us understand how to overcome this, how to eradicate it, or how to prevent it. The single and the straightmost answer that you will get is, please do start taking care of your health and manage your blood glucose levels. If they are extremely fluctuating, that is dysglycemia, extremely high blood glucose level or extremely low blood glucose level, then it is going to cause again and again, and that is the unfortunate part of it. The moment when you're going to start control your diabetes, it automatically going to help you in managing this frequent urination. Your HbA1c levels reducing over a period of time will also reduce this frequent urination issue. So what you have to do, you have to definitely work on three major planes. That is your food habits, that is ahara, your vihara. Two major things that you should definitely work on: physical activity, eating clean, nutrient dense food, phyto rich nutrients. All these things have been very beneficial. Herbs like Buttermelon is very essential in managing it, and many other fenugreek, tulsi, then turmeric has been shown to be very beneficial in managing this frequent urination over a period of time. So these are the certain herbs that you can include in your diet to make sure that you are able to manage your diabetes also, but also the frequent urination. So these are the major means. So controlling diabetes, the goal should be controlling diabetes, and what are all required, that should be corrected. Correction of your micro deficiency, being physically active, then sleeping at the right appropriate hours, making sure you are taking care of your health entirely. So all those things is going to contribute in the process of managing your diabetes. Once your HbA1c level starts dropping, once you're able to manage and control your diabetes, then you will automatically see the reduction of frequent urination. It is a symptom that your body is saying that there is excess amount of glucose circulating in the body, and it has to go out some or the other way, and that is what your body is trying to tell you or indicate you. So this is the most common symptoms seen in most of the diabetics, and it is not necessary that everyone who is suffering from diabetes should have it. It is not a compulsion. It may or it may not. So if you are one among that, then these are the means, and this is why it is happening to you. This is how you can manage. So these are the things that you should be following. And with that, and I hope I've answered the question. If you have still more questions, please write it in the description so that I can get back to them. I can address them, I can discuss them, I can answer you in the next session, in the next Wednesday live session, so that you will get the answers which you're looking for in the Ask Me Anything on Diabetes with me. So as I said, you need to create a right environment. And how do you create right environment is something that we have discussed previously now. So make sure that you create a right environment so that your body starts healing and reduces this frequent urination symptom that you're going again and again to. So these are the means that you can manage. Make sure that you are able to study, make sure you're able to take care of your health, and this is what will help you in the long term in managing diabetes. With that, I'll take a leave. Have a great week ahead, and take care of your health, and drop your questions down, and make sure that you go through the various links that is provided in the description, so that you get the maximum amount of benefit that you are looking for from us, and we are at the most best possible way to answer your questions. So please drop your questions, and with that, I'll take a leave, and I'll see you on the next Wednesday in the live session to answer the questions that you're going to ask me. See you.